Welcome back all of you to a new video on exam preparation. In this video, we will discuss about important memory techniques for preparing for various government nursing officer exams. All of us spend a lot of time and energy to study for exams, but sometimes we are not getting the desired result. For a better performance and better result in exams, we should learn how to study effectively for exams. How much time you spend or how much you learn does not matter really. What matters is how much you remember and apply for the exams. For this, we need to practice studying through memory tricks. Many memory tricks are there to learn. In this video, I am teaching you some of the important memory tricks with some important topics in nursing. The first one is compare and contrast. This is one of the effective technique. Let us see the technique through the important topics in nursing. FSH and LH functions. Here we can study this separately as functions of FSH and functions of LH, but that will not connect you much comparing to this method. So here we are comparing both FSH, follicle stimulating hormone, and luteinizing hormone with the similar characteristics. Here you can see FSH is for estrogen and estradiol release. Here LH for progesterone release. So the releasing characteristics we are comparing here. FSH for estrogen, estradiol, LH for progesterone. Then for the ovum characteristics, FSH is for ovum development and LH is for ovum release. FSH is for ovarian follicle development, here LH doing for corpus luteum development. FSH is for sperm maturation and LH is for testosterone secretion. So these characteristics we are comparing here. Next we will see the contrast, because these two diseases, Cushing's disease and Addison's disease, are opposite characteristic diseases. Cushing's is hyperactivity and Addison's is hypoactivity. In Cushing syndrome, there is water excess. In opposite side, in Addison's, it is dehydration, opposite character. Cushing's it is hypertension and Addison's it is hypotension. Cushing's it is hyperglycemia and Addison's it is hypoglycemia. Cushing's it is hypernatremia and Addison's it is hyponatremia. Cushing's it is hypokalemia, here Addison's it is hyperkalemia. So these all characteristics in the opposite direction, so we are comparing and contrasting in a table. Similarly, for hyper and hypothyroidism, again the opposite characteristics here. Hyperthyroidism with weight loss, hypothyroidism with weight gain, hyperthyroidism with tachycardia, here in hypo with bradycardia, hyperthyroidism with heat intolerance, here hypothyroidism is with cold intolerance. Hyper is with hair growth and hypo is with hair loss. Hyperthyroidism is with sweating or diaphoresis and hypothyroidism is with dry skin. So here also the opposite characteristics we are comparing and contrasting. Next topic is placenta previa and abruptio placenta. Placenta previa is with painless bleeding. Here in abruptio placenta it is painful bleeding. Placenta previa is with bright red bleed and abruptio placenta is with dark colored bleed. Placenta previa preeclampsia is not related, but in abruptio placenta it is sometimes related. Placenta previa feel of uterus soft and relaxed. Here in abruptio placenta it is rigid and tender. FSH present in placenta previa and that is absent in abruptio placenta. Here you can observe the color coding also I added for better memory. So multiple memory tricks I added. You have to observe and learn. color coding technique will be coming in the next session. I will discuss detailedly. Next topic is types of joints. Types of joints are synarthrosis, fibrous or immovable joints. Example is skull. Amphiarthrosis, cartilaginous, slightly movable. Example is vertebrae. Diarthrosis, synovial joint and ball and socket joint like shoulder. Condyloid joint is freely movable joint. Example wrist. So here we are organizing the things from not movable or immovable to freely movable. So this way we are comparing and adding the terms so that you can order in a sequential manner. Next one is gastric contents and area of secretion. Here you can see the 4 gastric content and the area in the next session. Here I added again some color coding also for better memory. One by one we will see. HCl, it is hydrochloric acid. So acid is a burning thing. So flame color I have just added here. HCl and intrinsic factor is secreted by the parietal cells. Mucus is yellowish color, right? So the mucus I added this color. Mucus is secreted by the goblet cells. Pepsinogen and enzymes, chief cells. Water, it's blue color water. So water and minerals and salt is secreted by the gastric glands. These all are important topics you have to remember with various memory techniques for your exams. Next method is color coding, one of the important memory technique. Here you can see the color coding, amniotic fluid color and indicators. Normal color is, normal color of amniotic fluid is pale straw color. Now I added the color according to the stage. Greenish is meconium stained fetal distress, greenish yellow post maturity, golden RH incompatibility, dark brown for uterine death IUD, and dark color is for concealed hemorrhage. So you can just remember these colors and the corresponding indication of the amniotic fluid color. Again, types of lochia according to the color. Lochia rubra is red, that is in 1 to 4 days. Lochia serosa, it is 5 to 9 days. It is 3 color. It can be brown, pink or yellow. That's why given the pinkish color. And the Lochia alba, you can see by the color itself, it is white, 10 to 15 days. So Lochia rubra red, serosa pink, brown or yellow, and alba is for white. Here also the color coding is used for a better memory. Again, Benedict test and indicators with the different colors. Here blue color, nil, absence of sugar in the top. Brick red is the down, that is above 2 is there, 5 plus. So blue absence, green trace amount, green precipitate 2, yellow precipitate 3, orange precipitate 4, and brick red is for 5. So this is the different indicators for Benedict text and sugar indicators. Venturi mask color codes. Blue 24%, white 28%, orange 31%, yellow 35%, red 40%, and green for 60%. Maybe you are thinking how we can relate it to this to the color. Because here I am arranging in a particular way, particular manner and with particular color. So even if you didn't remember the percentage, maybe you will remember the position and color in your exam because the visuals will be connected more to your brain. So according to the visual, you can at least eliminate some options and you can, for example, you can remember that in that page, the blue was in the top and the green was in the down place. So it is from 24 to 60%. So green will be higher percentage and blue will be lower percentage. So here also in Benedict test, blue is in the top and brick red is in the last. So your brain will automatically remember these things. This is the point we are adding color code for better memory. So next topic is some drugs and syndrome. Gray baby syndrome is for chloramphenicol. Gray chloramphenicol. Redneck syndrome is for vancomycin. And orange discoloration is for rifampicin. Eighth nerve damage is streptomycin and peripheral neuritis is for isoniazid. So this I already added in some other topics as well. You can refer this. I'm just mentioning because we are just coming through the color coding. That's why I just mentioned this for this memory technique lessons. Another one also we already added many times. Many of you might have seen this. This is also one example for adding colors and memorizing. Here you can see the green color given for sensory, blue given for the motor, and the mixed color. Blue and green mixed color is given for the mixed nerves. So this is also enhancing your memory to memorize the cranial nerves in a better fashion. And another method is also added, afferent and efferent nerves. This also asked frequently in the exam. So afferent nerves are sensory nerves, AS, efferent nerves are motor nerves, EM. So ASEM is also a short code for connecting the cranial nerves. So you remember the sensory green 1, 2 and 8, 3, 4, 6, 11, 12. The blue color is for motor and the other remaining is for the mixed nerves. You have to by heart this because this is one of the important topic for your exams. Afferent is sensory and efferent is motor nerves. ASEM. Next one is grading or ranking according to the priority. So this is also one of the method of learning or memorizing in a better way. Let us see the degrees of uterine prolapse. First degree, second degree, third degree. So from top to bottom we are grading it. First degree, cervix within the vagina. Second degree, cervix protrude through introitus. Third degree, uterus and vagina are completely out. So first degree just inside. Second degree little bit coming out, protrude through vagina. Third degree complete out. So this is the grading method. Next topic is types of placenta previa. Type 1, low laying. Some parts reach to the lower segment. Type 2, marginal. Reaches to the margin of interloes. Type 3, partial. Partially cover interloes. Type 4, central. Completely cover interloes. So here also it is from the low grade to high grade. Perineal tear grades. First degree, second degree, third degree and fourth degree. First degree involves superficial tissues of perineum and vagina. Second degree obviously first degree plus muscles of perineum. Third degree again tissues of second degree plus muscles of anal sphincter. So what you need to add extra is what is additional in that particular tear. For example, in second degree the additional is perineal muscles. Third degree the additional is anal sphincter. And fourth degree perineal tissue, vaginal mucosa, muscles of anal sphincter and rectal mucosa. So completely is there. So this is also according to the grade or severity. First degree, second degree, third degree and fourth degree. Tumor grading. Grade 1, grade 2, grade 3, grade 4. Grade 1 mild dysplasia. Grade 2 moderate. Grade 3 severe. Grade 4 anaplasia, that is cells undifferentiated. Mild is cells well differentiated. Moderate is moderately differentiated. Severe is poorly differentiated. Anaplasia is undifferentiated. Next one is tumor staging. Stage 0, carcinoma in situ. Stage 1, tumor limited to origin tissue. Stage 2, tumor has local spread. Stage 3, tumor has local and regional spread. Stage 4, distant metastasis. So these all are the different stages. Stage 0, carcinoma in situ. 1, limited to origin tissue. Again it is stage 2, it is more spread. Then stage 3, it is local plus regional spread. Stage 4, more distant metastasis. So this is according to the stages. So here also according to the grade, it is low to high grade. So according to this also you can arrange the topics and different memory techniques you can use for different topics according to the nature of topic and your convenience. Here another method is short codes for memory. We will use some short codes, interesting codes for connecting the words and memorize in a better fashion. This is one example. The sutures, sagittal, coronal and lambdoid suture, where it is located, and metopic also added it is. So PPS, PFC, POL, FFM. This is the short code you have to remember for remembering the sutures, important sutures. PPS, PFC, POL, FFM. Let us see what is that. PPS, parietal plus parietal is sagittal. That is, so sagittal suture is in between two parietal bones. That is PPS. PFC, parietal plus frontal is coronal. So the coronal suture is between parietal and frontal bones. POL, parietal plus occipital is lambdoid. That is the short form for lambdoid to remember. POL, parietal plus occipital. FFM, frontal plus frontal is metopic. So in between frontal bones, the metopic suture. In between occipital and parietal, the lambdoid. In between frontal and parietal, the coronal. In between two parietal, it is sagittal. So PPS, PFC, POL, FFM will help you to remember it in a better fashion. Next topic is brecma and lambda. The anterior fontanelle is brecma. It is diamond shape, diameter 2 to 4, fuses at 12 to 8 months. 12 to 18 months. Lambda is posterior fontanelle, triangular shape, diameter 1 to 1.5 and fuses at 1 to 3 months. So how you will connect this? Here is the code for you. Bad 12 to 18. So this is the teenage. Teenage is a bad time for controlling for the parents. So bad 12 to 18, I just connected it like that. You can use your own method also. For me, I just added like this. Bad 12 to 18. LPT 1-3. So LP school is 1 to 4 classes, right? So that's why I added this LPT, lower primary school. So bad 12 to 18 and LPT 1 to 3 is for the memory tip for anterior and posterior fontanelle, brecma and lambda. BAT is the brecma anterior fontanelle diamond shaped. That is the BAT. Then fuses at 12 to 18 months is the 12 to 18. BAT 12 to 18. Brecma anterior fontanelle diamond shaped, fuses 12 to 18. Lambda posterior fontanelle triangular shape, fuses at 1 to 3 months. That is LPT 1 to 3. Types of pelvis: gynecoid, round shape, android, heart shape, anthropoid, oval shape, platypelloid, flat and kidney shaped. This whole topic I explained in many sessions. That's why I am not going to the detail. I am just focusing only on the memory tips. All topic I am just focusing only on the memory tricks. So if you want more details, you please go to the previous mock test and mock test explanation videos. Here the code is Grahau PF. So pelvis Grahau PF, that is the code. So GR, gynecoid round, H, android heart shaped, AO, anthropoid oval shape, then PF is for platypelloid in flat shape. So this kind of short forms, if you remember, you can immediately connect between the option and you can eliminate the wrong options and quickly you can find the right option with this memory tricks. Next topic is, you can see the questions and connect. All the below hormones are water soluble hormones except option A adrenaline, option B glucocorticoids, option C glucagon, Option D, insulin. The right answer here is glucocorticoid, because this except is coming. So adrenaline, glucagon, insulin are water soluble and glucocorticoids are fat soluble hormones. So how it is lipid soluble and water soluble hormones are there. So how you will remember lipid soluble important hormone? The tip is steroids and thyroid hormones are lipid hormones, lipid soluble hormones. So how you will connect it? Lipid is oil. So like oils are just like fat or lipid. So the oids, steroids, thyroid, the oid part is equal to oil and it is lipid. So this is the way I connected this. You can remember this. So when you see the oids, it is something related to oil and it is fat or lipid soluble. So glucocorticoid, thyroid hormones are fat soluble and adrenaline, glucagon, insulin, etc. are water soluble hormone. Similarly, here the next question, all the below are fat soluble vitamins except vitamin A, vitamin C, vitamin D, vitamin E. Most of you know this answer, but still for the memory trick point of view, I will explain it. Vitamin C is the right answer because vitamin C is water soluble, all other are fat soluble. So fat solubles are ADEK. This is the short form, ADEK. ADEK, fat ADEK. So vitamin A, vitamin D, vitamin E, vitamin K is fat soluble and water is BC. Water is BC. So vitamin B and C is for water soluble vitamins. Next kind of memory techniques, it is connecting words to memorize. Some words from the different options the interesting links we will connect and use it for memorizing. Let us go to the topics. Curvature of spinal column. Kyphosis, abnormal convexity of thoracic spine. Lordosis is curvature of lumbar spine and scoliosis is lateral deviation of vertebral column. This one we will remember it like kyphothorax, lordolumbar, scoliolateral. Kyphothorax, lordolumbar, scoliolateral. So if you remember this tip, you can answer of all the questions related to this topic. Again, next, types of skin grafts. Autograft, own part of body, allograft from own species, isograft from identical twins, xenograft from different species. The tip here is auto own part, allo same, xeno strange, iso twin. Xenophobia is fear of strangers. So xeno strange you can remember. So allo same species, xeno different or strange species. Iso twin, identical twins, iso. So iso twin we can remember. Then auto is own part. So this is the memory tip for skin grafts, different types. Then stages after death, 4 stages. Pallor mortis, algor mortis, livor mortis, rigor mortis. Pallor mortis, skin pale due to blood pooling. Algor mortis, decreases in body temperature. Livor mortis, discoloration of skin. See the color code also I added here. You can remember this. I am adding multiple memory tricks in all of my study materials. Rigor mortis, stiffness of body 2 to 6 hours. So here, pallor mortis, pallor pale, algor cold because the body temperature is coming down. Liver color, livor mortis is discoloration of skin. So liver color, rigor stiff, rigor mortis it is stiffness of the body. So we can remember this. Pallor pale, algor cold, liver color, rigor stiff. Next topic, areas of brain. Frontal lobe is controlling voluntary muscles calculation knowledge. Parietal lobe is controlling the concept formation, spatial orientation, etc. Occipital lobe is for vision and temporal lobe is controlling the auditory and olfactory areas. So here the tip is front knowledge, parietal concept, occivision, tempo-odi. front knowledge, parade concept, oxyvision, tempo ori. So, if you remember this short form, you can just connect it to frontal lobe is voluntary muscle knowledge calculation, parietal concept formation, occipital is for vision, and temporal lobe is for auditory and olfactory functions. So these all are some of the important methods how you can memorize the topics in a better way, connect it with your surroundings or your familiar things, learning unknown to known, connecting the unknown thing to known things so that it will be more linked to your brain, and using vision, visual effects like color, animation, etc. for better memory. So try your own memory tips, and you always try to share your knowledge, share your tips, discuss in the comment box. Interesting memory tips you have to bring. This way, your exam preparation will be more effective and you can perform much better if your upcoming exams. I will add more topics on memory techniques, memory tips, and mock test explanation series, etc. Thank you all for watching this video. Please add your valuable feedback and please like, share, and comment for more videos.